Hi Emily, how are you?
Hi, I'm good. How are you?
Good, thank you. Thank you for coming to help me with this video. Is to demonstrate the osteopathic general assessment and treatment.
You're welcome.
Let's start in the assessments. We will start with our global assessment. I'll just follow my instructions to do the assessment. If you feel tension, discomfort, or something, tell me.
Okay.
The first is walk go back and forth. Okay. This walking is to see a general view for the body. The body. Flexion of the body include ribs, arms, neck, and knees. Okay? Now, good. Flexion the knee, flexion the head and back. Okay. Any pain, extension? Okay. Now, in extension, extend your arms, your back, your head. Okay. Any tension, pain, or something? Okay. Perfect. Now, circumcision of the hips. Then could you put your hands here, one leg, circumcision. Now again back. Now for the other leg and back. Now for the shoulders, same circumcision. One, back, another. Yeah. Okay. Any pain, tension? Okay. Now. Rotation for your trunk. Could you put your arms like this? I'm gonna stabilize your trunk to do the rotation from one side to another. Now rotate for one side. Now for another side. Okay. And the last one is a rotation for the neck. And then one rotation from one side. For another side, extension your head, and flexion. Okay. Any problem? Any pain? Nothing? Okay, this is a global assessment.
Yeah.
Now, following with the assessment is a time for T-line. T-line is with the climb in the supine position with the heels outside of the table. In T-lines assessment, we need see the restrictions in full body. It's okay, the fluid is for the full body or something happen. Start in with the legs. I got both legs and I can feel what is more heavy than other to see if the restriction to move one side when another. Now stabilize one foot in my heel, in my hip, and another to the traction and retraction, contraction and retraction, to see the movement of the body. In another side, same, stabilizing my hip and do the same. And follow the movement until head. Continue with the arms the same. And do it traction and contraction, traction and contraction. And doing the same for another side. Tension and contraction. For this assessment, when the arms sometimes climb, have the restriction on the arms, and it's better do the assessment, grab the area of the scapula and the arm to pull and do it, the movement. Have finished the test with the traction of the knee. Grab the knee between the C1, C6 and do the gently traction. Now it's time for the reflex test and sweat gland test. For sweat gland test, there's tissues put on the axillary areas, one for one side, this one on one side. While I doing the reflex test. Reflex test is in axillary area. Okay. And now will you give me the tissues? It's okay. Everything is normal. Now we start in the Mitchell test, structural assessment. This assessment is to find the restriction or lesion type 1 or type 2, neutral or type 2 in extension or inflection. And then start with the neutral with my fingers, with my dominant finger in the spine. And then with my dominant hand and eyes to look in. The vertebral extension is okay. Now in flexion, flexion, same, no bending, no. Now in the rotation, little restriction, a little tight muscles here in the left side more than right side. Now in extension, now for the pelvis, looking for the PSIS, and then could you go forward your tongue? Okay. Now could you back again? Okay. For this area, for this assessment, we found them high ilium, left side high ilium than the right side. It's okay. And then now for the nominate hips and then turn for the side. Good. This is okay. Now for the side, could you okay. Put your this is anterior nominate hip. Now for another side. Okay, now structural measure test, but in seat position. For seat position, the feet of the client is stabilized with in a stock, and do the same process, and then continue with my fingers to find the restriction in neutral. Neutral is okay. Now inflection. No side bend. No side bend. Position in the left, right is good, left. Okay, now in extension. It's okay. Rotation. And extension disappear. Everything okay. Now same with the hips. Will you forward your trunk, please? Little high medium in the left. Now back, please. Yeah. Okay, this is okay now. Fíjate. Hips here, ¿cierto? Ahora hago esto y subo acá. No, pero déjeme hablar. Momentico, avise. No. Now I gonna found that the client have a deep sulcus. Now go your trunk back, please. Forward. Now back. No, it's okay. It's normal. Measure test. No, measure test structural in prone position. Measure test. No, así no.
Ay, no.
Measure test structural in prone position. Climb is in prone position on the table, but with the knees stabilized in the edge of the table. Same here with my dominant finger to found the lesions in the neutral and rotations Okay, now in extension. Now in extension, the same, looking for the second lesion. Okay, now the pelvis, and then for the pelvis, we're gonna open both sides. Position my hand here. And looking for the hips. Could you forward? Could you turn in extension? And now back, please. Go back. It's okay. Now deep sulcus. Now in extension, please. It's okay. Now sacrum. Position my hand on the sacrum to see, to form everything, and I can look, I can form, and then I can form the coccyx, and then the sacrum is in contra rotation. And then now I'm gonna looking for restriction laterals. It's okay. Now could you put your extension? Is okay. Go back, please. It's okay. Medulla is okay. Only contra rotation coccyx. I can feel muscles tight in this area. Okay. This is a functional assessment with the client in supine position. I'm gonna measure the random motion of the legs, and then hip flexion for 125 degrees. Is okay. And compare with another leg. Same. Yeah. 125. Now new extension. The extension 90. It's okay. New extension. It's okay. Lateral rotation. This is 60 degrees. It's okay. And for this leg, continue with this leg in medial rotation. This is 45 degrees only. And now for hip cover and the way. Here is okay. It's 5 centimeters between the leg and the table. And here for extension, the knee for the hip cover. It's good. 5 centimeters. And and lateral rotation, 16, medial rotation, 35. It's okay. And now abduction, 40 degree. It's okay. 30 degree for this side. It's okay. Now for abduction. It's okay. On this side is okay too. Any pain, distension, nothing. Prone position, please. Prone position to finish the test is a deflation. It is in 10 to 30 degrees, and same this side. It's okay. And for hip extension, is 5 to 8 centimeters. It's okay. Pain, problem? No. Good. Now the assessment is a MET or manual energetic technique. Is for the resistance in my hand. And for example, in this case, for the flexion of the hip, I do the resistance. Client resists on my hand for 10 seconds and 10% forward. And same for the extension of the knee. Same. Do the resistance on my hand. And that's it. Okay. Could you turn for side bend? Supine position, please. And then same supine position is with the hip extension and do the resistance in my hand for 10 seconds. Same. Any problem? Okay. When the client have a resistance, have a problem or pain or imbalancing in the resistance, this help with treatment for the close and open the border forward who has in the leg. Same with the knee extension. Could you do the resistance on my hand? For the second, same in the other leg. And for the lateral rotation, same, do the resistance on my leg, like hand. And then for the middle, I rotate to the resistance on my hip forward. I'm gonna put my hand here, stabilize the hip, and do the resistance on my hand. 10 seconds. Thank you. And for same for this side, do the resistance on my hand. Do the resistance on my hand. Now for abduction, do the resistance on my hand. And then, like this, then I put my hands between the knee, and could you do the resistance on my hand? Same for this side. Do the resistance on my hand. Yeah. Okay. So it's finished with this treatment.
Yeah.
A special test. So for this treatment, a special test is the straight leg, no, what is it?
Yeah.
To the special test in this occasion is for the active stress leg rise test. For this test, we need found where is the problem with the sacrum, if it's a laxity ligament or for the muscular mobilization. And then the first, we're gonna ask the client to lift one leg first and another, please. Okay, we can find the restriction in the left leg. And now, could you push your both arms cross, and when I put my hand here, and could you lift this leg and try to move until meet the, and then it's okay. Let me know. Was easy to move or was more?
It was hard to move.
It's hard to move the leg. Now I'm gonna stabilize the hips and do it the same. Could you move the leg with the, and then let me, was difficult, was easy, was easier to move. That means the special test is a positive with the ligament. To do the correction for the high ilium, the client is in a side bend position with the affected area up. I stabilize this leg and here, and the client resists on the hip, on the ilium. 10% for 10 seconds. Now, this is the correction for the sacrum in contranotation dysfunction. For this, I open the ilium and position my hand here, exactly here, cover full sacrum, and with this leg, I'm gonna do the resistance in this area. Decline, do the resistance in my hand, please. 10 seconds. 1, 4, 5, 10. To complete the treatment, now I'm going to do reassess for the sacrum correction and for the ilium correction. to be sure that everything is right now in good position. First, I'm positioned on the sacrum and I can note the good level on the sacrum and can feel the coccyx and the sacrum in good position. My hand right now is more equal at the same time. Even here, these muscles are more soft after correction. Now, I'm going to make sure that the ilium, posterior ilium, high ilium is in now fits. And could you put in extension? Now it's good. Ilium is in good position, both sides. Now back. That means the techniques and the correction was good. That means the corrections is satisfied for the client. How do you feel?
Good.
Good?
Oh yeah.
Feel tension or pain or something? No? Tension disappear. Okay, Emily, to conclude the assessment and treatment, I want to explain about the evaluation. The conclusion that I found after all assessments that I did, I found that you have high ilium in the left side, and in your sacrum I found the contranotate. Contranotate is a movement that is more inside than the normal position. And then for the